Hi everyone, and welcome to a special edition of the Year of You, our Spotlight series. This month we're starting with the question, who do I see? Many people may start with a personal trainer, but there are other specialists like a physical therapist or even an athletic therapist. They all play key roles in helping support our body. If you find this interesting, don't forget to like this video, comment, subscribe, and go to www.drericaandyou.com. Let's jump in.
I'm excited to kind of bring this topic to the table. It really sparked something very personal because for me, I always think about physical well-being as important as mental and emotional well-being. Especially with me having had a physical injury, something that had me kind of questioning, like, what is wrong with me? And many people kind of have some of those concerns come up and they're always like, wait, who do I talk to? Where do I go? Or sometimes they ignore it. And I laugh because that's what I did for a while. I would muster through the pain and let it go. And so with that, I'm kind of following up on the last newsletter, which talked about mobility, and I wanted to kind of enhance that same theme and continue with talking about physical well-being and really talk to the experts. I definitely have a lot of fun with doing physical well-being by working out, and I enjoy that. But I love talking to people who have that knowledge and expertise when it comes to physical well-being. And so I've brought two individuals here that are going to provide and increase us with that information. And so with that, we're going to be talking about AT versus PT versus personal trainers. And so we're going to try to demystify any kind of confusion or clarify some information that maybe some people are not aware of. And so I would like to I would love for the people to introduce themselves. And so we can start with Miss Khadijah Williams to go first and introduce themselves.
Hello, thank you for having me on. This is great. Just kind of sharing everything. I am an athletic trainer, licensed and certified, and I have been an athletic trainer for about 5 years now, working in the outpatient setting, whether that be an orthopedic as well as industrial setting.
Thank you.
Hi, thank you for having me. This is really fun. My name is Julia, and I am an LPC licensed, and then I'm also a CrossFit Level 2 coach.
Thank you so much for kind of giving us an idea as far as your backgrounds. But, you know, what's really helpful is that, as I mentioned, the letters behind the names is great, but it still is not always clear to know, like, what does that really mean when you have the letters behind your names, or when people say, okay, you're an athletic trainer. Okay, wait, you mean personal trainer, right? or wait, you mean physical therapist? Like, what? So, Khadijah Williams, can you please clarify what is a license? Because you even said licensed athletic trainer. Please tell me what all these letters behind your name mean.
Yeah, so licensed athletic trainer, that is an additional credential. Really the basis of what you need as an athletic trainer is the certification. The certification comes from when you take your boards, where you have the whole exam and to credentialify yourself, right? And so with licensure, you have to go through the state, and that also just gives you additional accreditation with employment. So the basis is the certification. When you see certified athletic training, that means they passed the exam and you can see them as an athletic trainer. Licensure, that's just the additional thing to just give you additional accreditation.
To be fair, I'm not sure I've seen as many athletic. I always think of athletic trainer at a university where you're working with athletes. Where would you see an athletic trainer?
You can see them in a lot of different settings. Primarily it is in the school setting, working with athletes. I mean, it's in the name, right? Athletic trainer, athletes. You're primarily working with athletes. But that can range from middle school, can range from high school, collegiate, professional. They're primarily on the sidelines working with these athletes to prevent, do emergency care, things like that. But It's also very broad to where you can work in an outpatient setting. So that's at a physician's office, that's at a physical therapy clinic, that's industrial working. So it is very broad, but primarily like the basis is with athletes in the school athletic setting. They do go hand in hand, especially in like the physical therapy clinic setting, also industrial setting. Like in the industrial setting, you can be a physical therapy assistant and an athletic trainer to be an injury, and a physical therapist to be an injury preventional specialist. They can work hand in hand with that and work on the same patients and provide the same treatment, things like that. They just can't diagnose, right? Where in the PT clinic, it's nice to be able to have an AT, an athletic trainer, with you, because you can all have these fancy tools like electrical stimulation and compression devices to help with swelling and icing and things like that. So you have to be creative, especially with your rehab. So to be creative, it's using different tools within the office, rolling out, whether that be on like a tennis ball rather than using like an actual ball that's meant for rolling out. So having the creativeness in the PT clinic, you can help with like athletes, and also manipulation too. I will also add, you can't really manipulate. So if someone is having some lumbar pain and they're needing an adjustment, athletic trainers, that's out of the scope of our practice. Physical therapists, that's within their scope of practice. So if they're needing adjustment like that, you are wanting to refer that out. It's like a chiropractor, right? You want to see these specific special professionals to get this done. So it's, you go hand in hand, but it's very different. And like also like with some dysfunctions that you're born with, like congenital dysfunctions like cerebral palsy or spina bifida, athletic trainer, we're not going to really see that, because again, it's very complex. It's a whole thing that you need to know like the protocols with that. That is also something that a physical therapist is specifically you're going to be seen for. Not really athletic training. It's very concise, I guess you could say, whereas with physical therapy, it's a little bit more complex, a little bit more broad. They see a lot more different dysfunctions rather than like something that you see specifically at a sporting event, which is like a sprain. Your finger gets jammed into a basketball, or your toe hyperextends on the field, the turf field, right? So they're going to help with that. It's minor stuff, not more of those more complex and bigger areas and problems.
So even though the name athletic trainer is in your title, you are not always working with athletes, true?
Right.
And the concept is that personal therapist, physical therapist, and the athletic trainers work hand in hand, but more or less the athletic trainers are more from the rehab standpoint. And so we have to think about like the rehab.
Right, and prevention too. We're not just doing rehab, we're doing prevention at a sporting event, whether that be they're having a cardiac arrest, or they're having some allergic reaction, or they're having a diabetic episode. We're doing those on the sidelines. We're treating those emergency responses. So we can keep them where it's not fatal, right? It could be fatal if we weren't there, but we can keep them to where they're getting treatment, and then we'll refer them and get like an EMS, right? Where they can get an ambulance and then go to the hospital and treatment. And same with like if they're on the field, like you've seen it with the football injuries where a football player goes down and they're on a stretcher and they're having to get mobilized to the neck. Like an athletic trainer, they're going to treat that. They're going to see, oh, there might be something going on with your spine. We don't want to further this possible injury, so we're going to prevent it from getting it worse. We're going to splint it, and then we're going to get you to the hospital so you can get further treatment and further diagnosing, right? So it's a lot of things: prevention, diagnosing, and rehab. it goes all hand in hand.
Welcome back to our Year of You Spotlight. Last time we asked, who do I see? We explored how different specialists can support our physical health needs. Today, we're going to be focusing on the personal trainer. It's not just about working out or meeting fitness goals. A good personal trainer can support us in regards to restoring flexibility, having us move better, and also in regards to improving our strength training. If this video sounds interesting or even helpful, don't forget to like, add your comments, subscribe, and go to drericaandyou.com to get more resources. Let's dive in.
Whereas on the other side, this is where we get into the field where Julia's at, is people who are like, I want to start working out. And so that's when you may see somebody a little more often. But there can be situations where people may get injured. I don't know. But I want to get into that arena where, I know that this is not the umbrella so much of personal training, but you have worked in the gym, right, Julia? And so
yes.
I want you to kind of give some insights into that piece about like that arena of people may come to you and they're going to ask very similar questions that I'm even asking with Khadijah about, like, I hurt myself, or I have this injury. What's your suggestion? Because I hear it sometimes. Or I remember when I injured my shoulder, I went to the personal trainer. I have no idea what his credentials were, but I was like, he seemed like he had this awareness about personal training and they would do this mobility exercise. So I went to him and was like, I injured my arm and I don't know how I did it. And so I went and talked to him and I was like, okay, I'm thinking it's going to feel better. It did not. And so that's why I appreciated being able to talk to Khadijah, who was rehab, and she gave me a whole different slew of things, which helped it feel a whole lot better, because it's about the body, like your body needs a whole different type of mechanism on how to rehab because it's an injury. But I think of how often there are many people, because I remember hearing stories when I'm like, you're hustling, not intentionally, but you just hear people. So I want to bring that into that perspective of like your take on just maybe some of the stuff you even heard, but just as a person who works in the gym.
Yeah, it's a great example of something that I think is really important, I guess, when you're dealing with people who are licensed, is that they have to know their field of scope, like their scope of practice. I think Khadijah, you mentioned that earlier, like that's beyond mine. I refer them out. And like as a trainer, that was something I took very seriously because I know I'm not trained as a physical therapist or an athletic trainer. I am very specifically a coach for people who are seeking to become healthier and stronger, but are not actively experiencing injury or any kind of pain or physical issues. And so my job is not to fix pain. It is to help kind of more prevent it by helping people learn how to move well and become healthier and stronger and fitter in their lives to accomplish whatever it is that they are looking to do. And if they do become injured or if something happens, some things that I saw more frequently, I could look at movement patterns and help them fix a movement pattern, which would then fix the problem. But oftentimes, if I can't identify a movement pattern issue, then that becomes far beyond outside my realm of scope. And I would tell them, like, you need to talk to someone who's trained in how to fix pain, because that's not what I do. And that's a really good example of why, because as an athletic, a coach, I wouldn't know what exercises would help fix a shoulder pain like that. And I could cause more damage by giving the wrong solution or attempt at a solution instead of allowing them to be referred to where they need to go and giving them the right direction. So that's kind of was my experience as a coach, was more focused on helping people who were well, who wanted to become more fit and healthy, not people who were sick or injured in need of healing.
Is the right person to look for?
That's a really good question. I mean, I think part of it is like listening to conversations like these where you can get more information on the differentiating factors between these licensings and like trainings that people go to become whatever they're doing. So the more that you educate yourself as an individual, the more you'll know what questions to ask and like who to talk to. But like, I think like a good place to start is like, if you are not experiencing pain and you just want to become fitter, going to the gym and talking to a personal trainer or a coach is probably the way to go. If you're experiencing pain or issues in a movement pattern, like that's affecting your day-to-day life, going more the physical therapy or active athletic trainer route is going to be what you're going to want to do to address that problem. And that's probably where I would like start the spearheading of what you're going to want to look for and who to talk to.
Well, even thinking about that too, because I feel like a lot of people think of that terminology though as coach though, and they always kind of wonder about like, you know, what that even means. But how do they know what to look for when they pick a coach, or how to differentiate the right person to talk to when they even go to the gym, or what are the things to think about?
That's great. I wanted to add, because you don't want to further harm yourself with doing these things. Yes, you want to stay active, but if you do it in a way to where you haven't talked with the necessary people to help you with that, either go to a physician, right, and get a referral to go see this, or go to a gym and talk with these people to see, I'm looking to do this, I'm looking to improve this, how do I get there, rather than just doing it, right? You want to get those professional people that have the right knowledge to get you to where you want to be. Otherwise, it will be detrimental for sure.
Because what would I always wondered about that too. Like, what is the physician or personal trainer going to be telling me before I start doing this program? Are they going to say, oh, your labs are telling me that something is wrong? Is that what they're trying to say? Because they always say consult with the physician first before you start any program. I never asked that question, and I'm always wondering about that too. What does that mean?
Well, it's like you want to know, yes, you have pain, but you want to figure out or a weakness, right? But you want to know where that's stemming from. So you can't just assume, hey, it's my back. Because a lot of people, they could have back pain, but that might actually be caused from your hip. You can get referred pain to different areas. So you can't just off the jump say that something's going on and you just research it and you think that's going to fix the problem. It could be completely different that you didn't think about. So that's why you need those experts to look at you in a whole body and figure out what's going on and then lead you in that direction. It's like radicular pain. You know, you're thinking that you have leg pain, but it's stemming from your back. So you actually need to get some physical therapy for your back, straighten your abs, and maybe even think about, if that's needed, further treatment like injections. So you have to get that expert opinion before moving forward and jumping in somewhere.
Yeah, I would very much agree. I think oftentimes there are people who are paid to program and teach working out, essentially. Most personal trainers will like program for you, depending on their experience and like their licensure. Sometimes they do nutrition alongside that. That really just depends on the personal trainer. And you have personal trainers who specialize in different types of movements or types of working out as well. Like someone at a more global, like Lifetime Fitness or Anytime Fitness, something like that, they're going to do more machine work, more like what you would traditionally see as like lifting on a machine within a gym setting. Whereas if you go to like a jiu-jitsu gym or a CrossFit gym, you're going to see different kinds of training there, as far as just different types of movement patterns, different types of machine or equipment you might be taught how to use. And so knowing where to go and who to talk to is kind of going to be based on what you like to do, honestly. Like, what are you interested in doing? What's going to be a movement that you enjoy, that you want to keep pursuing? That's kind of going to be the key to Lifetime Fitness, is going to be finding a movement that you enjoy doing with your body that produces the results for you that you want. And so I think that would kind of be the thing to look for if you're looking for, like, if you're healthy and you just want to become more fit, start thinking about what movement patterns do you enjoy. Do you like cardio? Do you like lifting? Do you like dance? Do you like cycling? Like, those things are going to be what you're going to want to look into then for a trainer is someone who specializes more in that area. If you hate lifting and you go to a Globo gym and they start putting you on machines, you're going to hate your life and you're not going to want to go back. And so don't force it. Like, work with yourself to do what you love rather than trying to force yourself to fit a mold that you think you have to fit. You don't have to fit a mold. You don't have to fit an expectation of anybody else. It's your life and it's your body. So if you're wanting to become healthier, find what you love to do and then do it, and allow that to kind of be your compass about where you go and who you talk to, if that makes sense.
No, it makes total sense. And I think that's what is really the piece that I'm also wanting to echo in this conversation as well, is that, you know, many people are sometimes curious about stuff, and I think they're always trying to go on Google search and figure out information before they even reach out. But a lot of times it's like you're inundated with so much information. But what's helpful is sometimes just to have some people to maybe do some of the legwork to figure out, like, okay, what is it that I'm supposed to be asking, or what am I curious about? And a lot of times people are not curious. And so I appreciate just the notion in that sense of like, in a, you know, way to kind of just symbolize it in a short sentence. It's like personal trainers, they understand the gym. They know the science behind what the machines do and don't do, and they will teach you how to do it. So that's great, you know?
Yeah.
And I think that's helpful in that sense, but it's also great to be able to figure out, like, okay, who are the right people to talk to get that information? Because you said it, Julia, if the person doesn't give you the right insight, you're gonna hate wanting to go to the gym. And so I think that's the piece about just figuring out, like, how can we know who is the person I need to talk to? Because as I started off, is sometimes we will get excited about doing these physical activities and then all of a sudden we get injured. And I've done that, where I remember starting to run and all of a sudden getting shin splints. And I was like, oh my goodness, this is so painful. I don't want to do this anymore. But if we get the right information, we can actually prevent ourselves from getting injured, you know?
Hi everyone, and welcome back to our Spotlight series. We've talked about mobility and who do I see when it comes to my body. Today we're going to ask the question, how do I build strength that will last a lifetime? We will share practical ideas and strategies on how to build with confidence for everyday life. If you find that this information is helpful, don't forget to like, share your comments, subscribe, or visit drericau.com for more resources. Let's jump in.
So I would love to kind of get your insights in regards to some of these, or debunking some of these myths about strength training or weight training in regards to people with different body makeups, or just thinking about in regards to the idea about maybe women who may be thinking about, like, oh my gosh, should I not?
This like expectation that women are supposed to be small, that you're not supposed to take up space, that you're not supposed to be too strong or too big, and that if you do become that, then it's not good and you're somehow less valuable as a person. And there was a lot of fear and a lot of I think an unhealthy relationship, like even to food or to my body, where I was like high control relationship with food and very afraid of eating too much, and these things that like just very much restricted me. And I see that in a lot of women that I've coached through my years of coaching, who would come in their 40s and 50s, who were developing like osteoarthritis and like weak bones and like things that were going to continue to cause major health issues as they aged, because they were never taught how to take care of their bodies and maintain muscle mass, especially once you hit like menopause and things. The hormones completely change your body. And you start very quickly after your like 30s, if you're not actively lifting and like seeking to maintain muscle mass, you lose it pretty quickly as you age. And so this rhetoric of fear around becoming too strong or too big actually has detrimental impacts on women's health as they age and get older, because they're just not prepared to be able to age well, and it increases risks of falling as you get older. It increases risks for like across the board.
I also think too, like with lifting bulky, a lot of it comes when you see like those really big people that have those big shoulders, and you know, a lot of it is diet as well. You're not gonna get that big just by lifting 50 pounds. Like you're gonna need 80% of it is outside of the gym. It's eating. So you're not gonna get just massive just by lifting heavy. You need to also eat in a specific way to like with protein and things like that. And then also when you do lift that way and you're not eating like that, that's not what you're going for. It's going to lean you out more than anything rather than make you super bulky. It's going to make everything in a way that is going to accentuate your features rather than make it bigger.
Absolutely. The more like I learned about like performance training, where people are training for like performance competitions of some kind, the more clear it became to me, like these people are professional athletes who cycle in their training and in their food and their eating. They have an on season and an off season. And especially in our culture with like social media and stuff, you only see those people in their on seasons with their like performance pictures. And that is when they are, you know, specifically eating only these foods, and they're sleeping a ton, and they have specific recovery strategies. And it's like a full-time job to be at that level of physique and of physical training. And you're right, like 80% of it is not even in the gym. And so, yeah, if you are training to be healthy and you can lift quite heavy and effectively and just like lean out, essentially, you're absolutely right. And it's actually incredibly beneficial to your life. And to your overall like physical health as well as your physique.
And like weight training, lifting is very beneficial for longevity. That you know, we need to maintain a certain amount of muscle mass, and I think about it as definitely someone who is getting more into that middle age. Shouldn't say getting more. I'm in there in the middle age group that. Muscle mass is so necessary to maintain, because you're losing that as the years keep, you know, going by. And so this for many years, sitting is the new smoking. So if you're a person who's always sitting, you're doing more harm to yourself than having to walk.
Those are really great points, because if you don't use it, you're going to lose it. It's like that saying, if you don't use it, you're going to lose it. It also will worsen just kind of your way of life. It can lead you not moving and you not using those body parts that are needed. It'll affect your posture. It will worsen and lead to arthritis and worsen that arthritis. It makes your way of living a lot harder, especially as you get older. Even with your hands too, like that can lead to arthritis in your hands. You can't open a jar. You can't open these doors. You can't do your hair. You can't go in the shower. So you have to use those parts that were given on a regular basis. Otherwise, they will slowly deteriorate and lose function as you get older, unfortunately. So you just have to be cognizant of that and keep your body moving. You know, movement is the best medicine, right? Going on a walk, you know, going outside, and just even, unfortunately, some people, you know, you just have to be active with whatever you want to do. You can't just sit around. You have to stand, walk, you know, do these things that help your body.
Thinking too, as you were sharing and what you're saying too, Dr. Wade, like I think of every different season of life, you're going to need movement. Like when you're 70 and 80, you're going to want to be able to sit on a toilet and get back up again. That's a squat. You're going to want to be able to pick up your milk off the floor. That's a deadlift. Like you're going to want to be able to get your glass down off the shelf. That's a press. Right. And so like the movements that we do in the gym, if you're not training in the gym for your life, then like don't bother. Like, not really, please train, totally fine. But like, that's why you train ultimately, right? Like when I'm carrying in my groceries, I'm doing a farmer's carry, right? Like moms, when you're carrying your baby, you're doing a one-sided suitcase carry, right? And so if you're not training these muscle groups and these things in the gym, when you go to do them in life, it's going to increase your risk of injury actually, and decrease what you can do. If you're not running and you're working out, you probably can't run with your 8-year-old outside, right? Like all of these things correlate to being able to live more fully and more actively and longer with more independence. And so like, that's how I think of training. It's, to me, it's very like functional movement. It's like, I want to be able to go to the bathroom by myself for as long as humanly possible. And there's a lot of linkage too between like physical movement and mental health, not only like emotionally against like depression and anxiety, but also against like Alzheimer's and memory issues. All of those things are very interconnected. And so I know, like, especially for younger people or those who want to lose weight, some of that is physical, like image and body image, which is so valuable and important. But consider that, like, even more so than that, like, there is such benefit to training these movement patterns because you use them in your day-to-day life, whether you realize it or not. And the more you do it actively and intentionally, the easier it's going to be through different seasons of your life. Like, I just moved into a house and I cannot tell you how many times I've walked up and down the stairs carrying boxes and furnitures and been grateful that I lift, because I literally don't know that I could have moved those boxes without it. Right? And so it's like different situations in life are going to call upon your body to do different things for you. And the more you care for it, the more it cares for you.
I love the piece about understanding that strength myth. Like, it's not so much about thinking of specifically, you know, heavy weights, or I don't want to do too many weights, I don't want to be too bulky, but really trying to understand that strength training or lifting is just as important as cardio. They go hand in hand because we need to be able to maintain and build those muscles. I don't know if there's other pieces that came up when I said that, but that's something I was hearing, that lifting is just as important as we grow and as we age. Absolutely.
I think that's great. I wanted to add, because you don't want to further harm yourself with doing these things. Yes, you want to stay active, but if you do it in a way to where you haven't talked with the necessary people to help you with that, then it will further harm you and make things worse later on as well. So you do need to you can either go to a physician, right, and get a referral to go see this, or go to a gym and talk with these people to see, I'm looking to do this, I'm looking to improve this, how do I get there, rather than just doing it, right? You want to get those professional people that have the right knowledge to get you to where you want to be. Otherwise, it will be detrimental for sure.